ecosystem, and more. It's a great learning experience and a great relaxation experience as well. With some good food, the Cyber Restaurant is also there as well. So you can spend a full day at the Safari Eco Park with the whole family. And rates start from 300 Ghana cedis only per person. And it's free for the kids under 6 years. So visit Safari Valley Eco Park with your friends and family for the thrill of a lifetime. You can call 0596 914394 for more details. So the Energy Commission announces for the information of the public, particularly electrical wiring practitioners, that the November-December 2025 certified electrical wiring examination will begin on Saturday, 29th and 30th of November at selected locations in Accra, Kumasi, Takoradi, and Tamale. Now, to apply for any of the 4 categories, domestic, commercial, industrial, or inspector categories, visit the online portal www.ghanawiring.com. Scroll down on the page, click on Apply to select your category. Upload scanned copies of your Ghana card and passport picture. Initiate payments via Momo or upload a scanned copy of pay-in slip from the bank and submit. Alternatively, to apply for domestic, commercial, industrial, or inspector categories, you can visit www.energycom.gov.gh. Click on flagship programs, then select electrical wiring, then select application form, scroll down to the bottom of the page and click on the link. Click on the link to register for the electrical wiring exam to be redirected to the examination registration portal to complete the registration. The registration deadline is 31st of October. Now, the registration portal will be closed after the registration deadline. If you want to find out more, you can contact the Energy Commission's Electrical Wiring Secretariat in Accra on 0302 938464 or 0302 813756 or 7 or 9. In Kumasi, you can call 0322 495 964. In Tamale, 0554 057478. In Takoradi, you can call 0248 045 845 or email info@energycom.gov.gh, or you can go to www.energycom.gov.gh. So the joy of every parent is to see their child grow to become more intelligent and physically fit. To achieve this desire, every parent needs to ensure that their children are given nutritious foods that have the essential nutrients which can promote their well-being. One of the best of such foods is Vitamilk soy milk drink. Yeah, made from whole grain soybean, which is a good source of plant protein, and it's enriched with omega-3, 6, and 9, calcium, and the essential nutrients and multivitamins recommended for healthy living. Vitamilk has no artificial coloring, no artificial flavorings, and no preservatives. Yeah, Vitamilk still remains number 1 in quality for over 20 years. So choose Vitamilk Champ for your children. Vitamilk also comes in its regular soy milk drink, Vitamilk Energy, the energy booster with no caffeine, Vitamilk Choco, Vitamilk Banana, Vitamilk Strawberry, Vitamilk 250 ml, and a Vitamilk 1 liter Tetra Pak. Vitamilk is indeed a nutritious beverage that feels good anywhere, anytime.
Joy 99.7 FM.
So this is for you, the boss lady listening to me now. Yes, you, the go-getter, the planner, the do-it-all woman, building her business one boat step at a time. MTN sees you, and we're cheering you on every step of the way. And that's why we created MTN Ejumapa just for you. It's more than a bundle. It's your new business bestie. With special data and call bundles, you stay connected to your customers, suppliers, and everything that helps your hustle grow. But there's more. MTN Ejumapa also comes with insurance benefits to help protect the business you've worked so hard to build. Because we know you're not just working for today, you are building a future. It's time to level up, scale up, and shine brighter than ever. Dial star 5060 hash, grab your Ejumapa bundle, and let's get to work on your success story together. MTN Ejumapa, powering women in business. Hey, have you checked out the Betway exclusives yet? Yeah, these are Betway's very own exciting games. Soccer Striker, Fly X, Chicken Games, Spin the Bottle, and many more. You won't find them anywhere else. They're quick, fun, and full of thrills. Only on Betway. So don't miss out. Log in today, play your favorite Betway exclusive games, and get way more excitement. Remember, Betway is regulated by the Gaming Commission of Ghana. No under 18. Bet responsibly. It's time to experience the ultimate waterfront getaway at Aqua Safari. Yep, you get to relax in style and comfort and let the soothing sounds of nature rejuvenate your soul. Come visit the best resort in Ghana. I'm talking from luxurious rooms and suites to exciting water sports and outdoor activities. Look, the stay packages are designed to provide you with an unforgettable experience at the serene bank of the Volta River at Bigada. So whether you're looking for a vacation destination or that perfect riverfront venue for your conference, your only option is Aqua Safari. Call 0800 110190 or 0540 110190 now. That's Aqua Safari. Well, our drive Dr. Yaw Osafo, CEO of Medicas Hospital in East Legon Hills and Mampong Equiapim is here. Dr. Yaw Osafo. Hello, dog.
Hi, Lexus Bill.
My dear brother.
Friday is going to be hot.
Are you all set for Friday?
January 1st, I always do something. Yeah, I call the Global that day and I ask them.
Wow.
The torchlight, dates.
When are we lighting it?
Yeah, that's the first date. I got that locked. So as
wow.
we say, wow, the emergency be about Friday.
Friday, dear. You're on your own. I don't even jam me.
No emergency after 4 p.m.
Please, if you're planning on falling sick on Friday,
postpone.
Forget it.
Please
postpone. Wait till Saturday morning or something.
Saturday morning. I didn't know
hangover.
I didn't say that.
Doctor.
Don't put words in my mouth.
Doctor.
You
say one standard wine.
Good afternoon to all our listeners. It's time for a very important discussion.
See, doctor planning for hangover. Today, me and you for here. One standard drink, you also have a teaspoon. Teaspoon. I don't know beer. Teaspoon. Friday, I will personally oversee what is happening on your table with your boys.
You will be on stage. We will be down there.
I will.
Christian gentlemen, singing, illuminate.
We never must lose.
Yeah. But it's always a great opportunity to meet classmates. We left school in '96.
Nice.
So it's a long time, and you don't get to see a lot of we still call ourselves boys.
Yeah. The men.
The joints.
The bald-headed men.
Like when you say it that way, it makes us feel closer to their grave, to their boys. So it's always a good opportunity to see a lot of our mates and find out how everybody's doing.
Yeah.
Reconnect, relive all the days back in the boarding house. And, it's just a wonderful oppority, and I'm really looking forward to, seeing Black Sheriff and then headline artists.
Yes, it's gonna be great.
I remember Ebony shaking the place.
Yes,
and I'll never forget that.
Yeah,
for me, it's the opportunity to see some of these artists for the first time on stage. So I never miss it. So
Ebony's concert at the bonfire is one of my fondest memories of the bonfire itself. I remember because I was hosting that event. I remember doing the countdown with her and all of that, and she was amazing that night.
The way people move,
oh boy,
towards the stage when she came on stage. That's when I realized how big she was.
Yes,
and when we're going later on, all the way to Atomic Junction.
Yeah,
so many people who had come just to come watch her, and it's an abiding memory. And she's what do you call it, showstopper? Or what?
Yep,
you know,
yep.
her
And
stage
especially for a boys' school, you know.
Oh yeah, you know, it's got everybody locked.
how it is, like,
we
you
were
know,
just crazy.
when
you
we are
know,
stuck in presec and we are not seeing any other gender.
we are deprived. Yeah, but her statecraft was just, you know, massive. So it's always a wonderful opportunity. I remember Sarkodie was there.
Yes,
you know,
yes.
yeah. And,
Looks like you don't miss the bonfire.
oh,
Hey,
no,
Dr. Safo.
Kwame, so what they are, maybe hell.
I
I want us to do the drive chat there, but yeah, to go, I invite you on stage. Right?
Mate. All right. So
Right,
last
nice.
week we did start a conversation about cancers. Of course, you've been doing some good work on the morning show with the team, and we
Right.
decided to extend the conversation here on Drive Time. We didn't finish that conversation, so today we have a sequel to that,
Right.
where we get to look at diagnosis and therapy as well, right?
Yes, absolutely. And Kwame, October is Pink October, Breast Cancer Awareness, but we decided to broaden the conversation and make it a Cancer Awareness Month. And I really like to congratulate Multimedia for taking that initiative. And yes, it is going strong on the Super Morning Show. Why not? Let's just also have a conversation, just a bird's eye view of cancers. We're getting better at it. In terms of the tools available to ensure early diagnosis. I think what we need to do more is the education so that people would present early enough to allow for the whole diagnostic process, early detection to happen. So today, the conversation is going to focus on cancer diagnosis.
Right.
Kwame, there's no single test that can diagnose cancer.
Oh, are you serious?
There isn't a single test, unlike, say, diabetes, where we would ask you to do, say, a fasting plasma glucose test or an oral glucose tolerance test, and we can nail the diagnosis. When it comes to cancer, it's not one test. It's a battery of investigations or tests. And sometimes that can be a bit overwhelming for the individual, for their friends, and then for their families as well. Particularly when we don't have, or we have very few centers where they've got the full complement of tests or that whole repertoire of investigations where you can get everything under one roof. You probably will have to go do this here, go do that here, go do this here, and it can be a bit frustrating. But I hope that by the end of this conversation, we will understand why it is necessary to get all these different pieces together. It's just like a jigsaw puzzle, if that's an analogy I can use here. And you've got to piece everything together so that you see the image, fully show up. So the first thing is that we've got general tests that your doctor most likely would request. These general tests are supposed to sort of like bring out complications that have either set in, or to see how ready you are or how suitable you are also for certain treatment options to be initiated. So, for example, your doctor would definitely ask for a full blood count, all right? Looking at your HB, your hemoglobin level. Cancer generally tends to get people to have lower than expected blood levels, and it is very important for us to optimize you, for example, with blood transfusions, to make sure that you're able to survive subsequent treatment. We can also do what we call the general chemistries: kidney function test, liver function test, urine examination, or we call it urinalysis. Just to see the state of function of these things. So these general tests would be ordered irrespective of the type of cancer that your doctor is suspecting. Now, let's jump into the specific cancer-related investigations. Kwame, the first thing I want to talk about is that umbrella term we call biopsies. So what is a biopsy? A biopsy is a procedure that your doctor will attempt to take pieces of or a piece of abnormal tissue from your body, send it to a pathologist, an anatomic pathologist, for examination, typically under using a very powerful microscope. And the pathologist would also run a couple of tests on the tissues or cells to get a better understanding. So, Kwame, you can have an ear biopsy, you can have a biopsy of your tongue, you can have a biopsy of the skin, you can have a biopsy of the breast, you can have a biopsy of the prostate. So a biopsy simply means that using different techniques, your doctor is trying to get a piece of the area where we believe the problem is located. And we use different techniques for that biopsy. So for example, sometimes the biopsy means that we stick in a needle, to aspirate, bring out fluid or small pieces of cells for examination. So we'll call that a fine needle aspirate. A fine needle aspirate. And then we would go and examine that. Sometimes we use we need a bigger piece of tissue. So we puncture or we punch out the tissue and take out a big chunk. Sometimes we would excise the whole thing, like remove the whole thing and send it, for further examination. Other times too, we'll do what we call an endoscopy procedure, where we pass a lighted tube or a tube with a camera at the tip down into the stomach, for example, or up your backside into the rectum and the colon, and then we see that abnormal structure, and then we will take a piece of it. So biopsies simply mean that your doctor attempts to take a piece of the body where we suspect cancer, gives it to a pathologist. The pathologist would examine it in his or her laboratory and then give us a firm diagnosis. All right. So most people would have a tissue biopsy done. Secondly, we have what we call tumor markers, right? These are biochemical tests. So, Kwame, most of the time we're using a blood sample. So we'll draw a blood sample and we would send it to another type of pathologist called a chemical pathologist. And that chemical pathologist is mainly interested in identifying chemical substances that are either produced by the abnormal cells or the cancer cells, or even produced by normal cells as well, but then when they become cancerous, they produce them in unusually high quantities. So the prototype when it comes to tumor markers, this biochemical test that I talk about, is the PSA. And Kwame, I'm sure a lot of people, you included, would have heard about the PSA, the prostate specific antigen.
Right.
So a lot of the times men above 40 or 45, when they go for their yearly screening, will have a PSA requested. It is a biochemical test. It is a chemical that is produced by the prostate cells. So every man, once you have a prostate, then you would produce PSA. All right. But the quantities that you produce is what makes the difference. All right. If you produce in excess of that upper limit, most of the time, most people will know this 4, then we would begin to take a closer look at the prostate. Sometimes it is not cancerous. Sometimes it's just that it's grown bigger. We call it a benign enlargement, but it would give you an elevated count. Today, before I came in here at the clinic, I saw a 60-something-year-old male with a PSA value of 8. All right. But 2 months ago, too, I got a relative whose PSA was 71. All right. I can tell you that for both individuals, or these two individuals, that person with a PSA of 71, likely, if we follow up with a biopsy, a prostate biopsy, it will come out as a cancerous enlargement. And the one with a PSA of 8, would likely come back as a benign enlargement. Both are above that upper limit of 4. So we use tumor markers, and there are lots of them. There are tumor markers that will help us diagnose liver cancers. We've got tumor markers that would help us diagnose ovarian cancers, bone cancers, and so on and so forth. Right. But these are generally biochemical tests, blood tests. We take blood samples. The next group of tests, Kwame, is what we call the imaging tests. So quite straightforward. We're trying to produce a picture of that part of the body we suspect has cancer. All right? And there are different imaging techniques. Let's start with the simple ones, an X-ray. So nearly everybody listening has taken an X-ray in their lives at some point, because most school entry, exam at the tertiary level will request you to take an X-ray. All right. Most people would have had a cough, which is bad enough for a doctor to request an X-ray. So X-rays, we are using low doses of radiation, all right, to create pictures of the inside of your body. Commonly, we look at the lungs, but we also use X-rays for bones, typically fractures, all right. But if we suspect that someone has a bone cancer, Kwame, we can use an X-ray would be a good first step. If we suspect someone has lung cancer, an X-ray is always a first step. You take that X-ray, and your doctor would look at it and probably find something on the X-ray that would push him or her to request for further investigations. The next is an ultrasound scan. All right. So an ultrasound scan, again, if you're a parent, then you're very familiar with an ultrasound scan, because if you're a mother, you would have had that scan performed on you during your antenatal period. And if you're a father too, then in accompanying your wife, hopefully, you would have seen the ultrasound scan, which is usually a very portable device. These days, we've got the screen is the size of your phone, and it's got a probe, or we call it a transducer, that generates high energy sound waves. All right, so X-rays are about sound waves, very, very powerful sound waves, but you cannot hear them, and they generate echoes when they bounce off tissues. And then you've got this device that puts all the echoes together to form an image. All right, so that is how ultrasound scans work, and we're able to see the baby in there and be able to tell, sometimes even the gender, and follow how well it is growing. Much the same way, if we suspect that you've got, say, something growing in your uterus, in your prostate, in your lungs, abdomen, liver, and all of that, the first imaging technique most likely will be an ultrasound scan. All right? It is non-invasive. We don't know the sound waves to be harmful long term, and relatively it is cheaper. So ultrasound scans are important. Then, Kwame, you may also get a CT scan at a point. The resolution of a CT scan trumps that of an ultrasound scan. Again, the technique is different. The CT scan uses an X-ray machine linked to a computer to take a series of pictures of your organs and from different angles. And then these pictures are used to create 3D images. All right, so that's what a CT scan would do. It will create 3D images of the insides of the body, and the resolution is much, much better. Then we also have MRI scans. We get an MRI scan done. This is scary. I've had an MRI scan done once before. If you are claustrophobic, then it is really, really scary.
It is.
It looks like, a coffin. And that's what comes to my mind.
They push you in that tunnel.
Exactly.
Tunnel, whatever.
It's a tunnel. It's a machine that wraps around you. And it uses a very powerful magnet and radio waves to take pictures of your body in slices. So it's slicing you up in millimeters. So at the end of the day, the slices are combined to create detailed images. All right. So your doctor likely will not miss anything. And if there's a tumor, then we are able to find it. Then we also have what we call the nuclear scans, where in this instance we're using radioactive material, all right, that are introduced into your body. And these radioactive materials tend to be attracted or congregate in places in high energy cells or cells that are abnormal in their function and structure, and those are the cancer cells.
Okay.
And the scanner would sort of like pick them up. So these are the various techniques.
Yeah, na omoye den who cancer no.
Kwame, big question.
Because
Big question.
all these scan, micro, ultra, why?
PET
I'm
scan.
just wondering.
There's even something called a PET scan.
So in the hundreds, in the 18s and the 1900s.
Kwame, all I'll say is that I am glad I am living in these times. We are living in much, 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 much better times.
Wow.
But even if you think about Ghana, Kwame, you remember Can 208? I think it was John Paintsel, who got injured, and he had to take an MRI scan or something, and he had to be sent to Nigeria, come back. This is Can 208. All right? So it shows you. Now, there are lots of centers in Accra here where you can get a CT scan and MRI.
Yeah.
I don't want to mention names, but I could just spit out 10 places where you can, like, any day. I know there's this place where 24 hours, 7 days in a week you can get them. So we've made great advances in science, and technology allows us to be able to do these things.
So now we do all these tests, and then we find that there's a cancerous growth or something of the sort.
Right.
What therapy options are available for whoever is in it?
Right. So, Kwame, again, early detection means that we've got great options and we've got great possibilities for better outcomes. Right. So the options are in three main areas. All right. Surgery, chemotherapy, and radiotherapy.
Okay.
Now to explain. I think surgery is quite straightforward. We know what surgery is. You're going to go under a doctor's knife. Okay. Sometimes it's a two-step thing, because the first one would be a biopsy type of thing. So you would have what we call mini surgery, where we get a piece of the tissue, we send it to the anatomic pathologist, and he or she would examine it and give us a definitive diagnosis. Based on that, the surgeon would go back, or your doctor would go back again, and then plan a much more comprehensive, surgery, where they're taking out the whole thing plus sometimes surrounding, structures, just to make sure that we've got everything. Okay, so that's a surgery. Chemotherapy involves giving the individual different types of medicines. All right, these are very, very powerful medicines, and for me, if I'm ever in that situation, probably I wouldn't take it very hard, because you would lose all your hair. Me, I already have lost my hair, so it's not a big deal for me.
So it wasn't chemotherapy?
No, it wasn't. This is God is my Baba.
Okay.
So, chemotherapy, we introduce these very powerful cell drugs that get into your body. They will attack primarily the cancer cells, but they would also get some of the non-cancer cells. And that's why all of your hair would fall out, for example. Damages your skin cells, and you may get darkening of your palms, your fingernails may change color, nausea, vomiting, some diarrhea.
Wow.
But we are just going after the troublesome cancer cells with these very, very powerful drugs. And because they're so powerful, we're not going to give you all at a go. So you get them in what we call cycles. All right, cycles. So we'll give you a set today. You go, you come back, say maybe in 3 weeks' time, you come and get another cycle of it, and then maybe come another 3 weeks, you get another cycle of it, and so on and so on, until we are able to say we put you in remission. All right. Sometimes you would get a bit of chemotherapy before we do the surgery, or sometimes we do the surgery and then afterwards you get the chemotherapy as a top-up because we're not sure we got everything. Once we put the drug in your blood moves everywhere, all right? So we're sure that as it circulates, if the cancer has moved to other parts of the body, and Kwame, that's one characteristic feature about cancer, it doesn't sit still. The cells move. Something we call metastasis. It's just like fire in the savannah during the harmattan, and then it gets windy. It's just jumping all over the place. So in a short time, you've got a large area caught up in the fire. So that's one characteristic feature of cancer. So somebody, for example, will get colorectal cancer, and when you find it in the liver. You get breast cancer, and you find cancer cells in the lungs. You get prostate cancer, and you find these same prostate cancer cells in bone. Bone in your spine, your skull, bone, ribs, and so on and so forth. So cancer moves, and that is the reason why you may need to get chemotherapy at a point where we introduce the drug and we put it in the blood, and it gets to go all around the body. Right. And then there is the radiotherapy. So radiotherapy, again, we're shining what we call ionizing radiation, very, very powerful radiation targeted at where the cancer is located. And typically they go for this option when we think the cancer has moved beyond its immediate confines and we need to get a wider area. Then most people will get radiotherapy. The radiotherapy sometimes, or most times, is external, but sometimes we can make it internal, meaning we will implant the sealed radioactive substance, near where the tumor is, and then it gives you sort of like near or release radiation very close to where the organ is. We tend to use it for, say, the thyroid, which is quite superficial. You can get that kind of internal radiation from it. Unfortunately, some people come to us very late, and that is where we would then look at palliative care, where mainly the focus is on pain management, nutritional management, and a lot of psychotherapy. So thankfully, we've got all of these options right here in Ghana, but Kwame, we don't have enough treatment centers and we don't have enough specialists. And I'm not talking only about doctors. We need to have oncology nurses as well. We need to have enough clinical psychologists, to deal with, to help such patients go through what they go through. So if you look at the human resource that is required, we don't have enough, and we don't have enough treatment centers if we're looking at the 16 regions.
Okay. Well, this has been some very good education. And if anybody out there wants some more clarity or needs your assistance with regards to our topic today, how do they reach out to you?
Right. So, Kwame, we do have a lot of these diagnostic capacities at Medicas Hospital. All right. The endoscopy, the x-rays, the ultrasound scans, the biopsies. So you can reach us 0501 477 340. The WhatsApp number is also 0501 477 340. You can actually come by. It's number 10 Kincho Street, East Legon Hills Enclave, and someone in the team will speak to you, and we would help you if you suspect that you have a diagnosis of cancer.
Right. This is good. I'm grateful that you came by, Doc, to share all this good information with us.
Pleasure is mine.
Thank you very much, and
I'll
thank you
see
to
you
the
next
team
week.
at Medicas Hospital. Yes, next week we continue our conversations here on Drive Doctor Chat here on Drive Time on Joy 99.7 FM, and of course I'll meet you on Friday as well at the bonfire.
Fire!
Yeah, I hope to see our brother, former assistant headmaster Prince Agote there as well, and he's tuned in. Senior, good to know you're tuned in to Joy FM. Prince Agote.
Yeah.
Have a good day. We'll see you on Friday night for the bonfire. To all of daddies listening, make sure you make your way to Presec Legon. Let's hang out. Let's catch up. It's been a while. Yeah, it'll be good to reconnect.
Wind down.
And what?
wind down as
But I
Christian
told you,
gentlemen.
this Friday, you are not winding down. This Friday, I will make sure personally. You come here and come and tell us you are going to wind down.
Oh, say
Said
the whole Saturday you are down. The Sunday up.